Alright. Hello, good evening, everybody. Welcome to Monarch Family Chiropractic and our spinal workshop Tuesday night on spinal hygiene. I'm Dr. Kristen. So welcome out in Zoom land and at home and here in the office. We're going to jump right into some concepts of what we mean when we talk about spinal hygiene. We have lots of workshops that we do on strength, on flexibility, on the molding process, right? So changing curves and regaining curves or removing curves if it's a scoliosis or a place where there's a curve where it shouldn't be. As well as we really get into some of the details of foam rolling and stretching and all of that. So this is incorporating multiple things of all of those areas that you can do at home and ways you can do some of them really without any extra tools. So we're going to go through some of the things of why we do what we do, why the body needs it, and then go through some tools that I brought from home, some things we have here in the office that we suggest you guys have at home, or things that are easy to find in sometimes a junk drawer, or if you have a pet, and different things that you might find that you just have around the house that you don't necessarily need to go out and buy equipment or anything that's very pricey for that matter, and be able to do movements for your spine and your nervous system at home with basic tools. So the first thing I always like to talk about first, though, is the core concepts around spinal hygiene. So as I was just alluding to, there's a couple things we want to have and some things we don't want to have. So I would say some of the things that are the three core principles is that when you have, I guess it'd be easier to almost use a spine model, but when we are in a good posture or while we're working on spinal hygiene is that the spine should be straight. From looking front to back like you're looking at me, there should be no curves in my spine from the top of my head down to my tailbone, right? And so we really want to have, our spine from that front to back view really be straight. From the side view, looking at me like you are now, there should be curves. There should not be a straight spine. So we really should have like a backward C shape in our neck, a forward C shape in our mid back, and a backward C shape in our low back, right? So we should kind of look like a reverse S when I'm standing this way anyway. And those movements and curves are all supportive for the weight of our body and how gravity works on us 2/3 of our life when we're standing up, sitting, and doing motions. And so we need those curves in order to, as you've learned in many other workshops that we do about curves, to stabilize our spine and distribute the weight evenly, right? So that not the neck or the mid back or the low back are doing all the work, that they're all getting equal distribution of our body weight and our motions. And we're designed to be in motion together. So if there's an area not moving, we need to get movement in there with some of our spinal hygiene exercises, because then if we don't have areas that move, then we're putting more stress upon the ones that do move, okay? So whether that's left to right or top to bottom. It's also really important that if you have this motion and you also have a motion in the sense looking through you that doesn't curve, that we really are supposed to, we're three-dimensional. We need to be able to move forward and back. We need to be able to move side to side, and we really need to be able to move in a plane where there are motions with a lot of our joints that, for rotation, right? So we need to be able to, in a sense, twist, side to side bend, and forward and back bend, right? So you'll hear us talk about, and those are the motions you see us do in the neck, the mid back, and the low back and hips. Every exam we do with you, from the start of your care to the very last exam you ever have in this office, that's what a motion will always be checked, because the hygiene of your spine, we can tell if it's off if those motions aren't normal. So when we go through your exams with you and we talk about where they're different, that's why. Some people say, oh, well, I have more motion in an area than I'm supposed to, or then they say is the normal range, right? Well, that tends to be at times because we have an area that's compensating for another. So we can have an area with less motion, and then we can find that another area gets almost overly mobile, hypermobile, and that's not stable. That can be unstable and feel not very, may feel challenging, or sometimes we feel leery to do motions in certain areas that have too much mobility, right? It's kind of like being a little Gumby, like it shouldn't move drastically beyond a normal range either. So we want to look at those ranges of motion, and that in all health professions, it's very widely accepted and stated that we need to have that full range of motion in all those directions. And of course, we are a musculoskeletal system. So another component with strength is that if our core and our spine and our structure is moving, is it stable and is it strong in the supporting elements, right? So are those postural muscles attaching to all of our structure strong and holding us and working left to right, front to back of the body? So the muscles around the spine have to be fit, they have to be active, and they don't want to be overactive, and we don't want them so tired and fatigued that they're almost shut off or shut down. So when we go through some motions today for things up top, things in the middle, things down low, it's really based around our core to a degree with spinal hygiene. But again, how to balance core and strength and balance between left and right, front to back, and how that affects these things right here. Because if we are imbalanced, you're going to have a pull to one side or another. Like when you see a scoliosis, right? So when you see a spine straight through, like looking at someone straight on, that should be straight and it does this. And then that means the hips do this. And that means these shoulders are tilted this way. And a lot of times the head is also tilted that way. Now that's kind of an extreme drawing, but that's not that extreme from many x-rays we look at as to what brings people into the office and where they have some of their aches and pains, right? And the body can do a lot of compensating before we realize that it's maybe doing this on the inside. So that's why those motions we go through is something we always will go through and assess, because muscles can trick us in how they're carrying or holding us. And pain is a very minimal indicator, as we talk about in here, of whether there's actually a problem, right? So looking at those concepts and what our goal is with spinal hygiene, there's a couple things we're going to go through. It's really ranges of motion and knowing that there are good stretches to do. We're going to go through some exercises and or some movements on different pieces of equipment, and then going through talking about in brief, because we cover all this in a lot of other workshops, but our core stabilizing things that are really related to spinal molding, meaning retraining a curve if it has been lost. So if you are looking sideways at somebody or at an x-ray and there's not these three curves here, then that is a structure that is going to degenerate faster, break down faster, age faster, and lose its mobility faster. It just compresses everything and creates lack of space where we need space between each joint, between each vertebra. And so that eventually causes a lot of tension and compression on our spinal cord and our nerve system. But in the day-to-day wear and tear of the bones, it really changes how drastically aged it creates our spine to be. Because again, it's just kind of compressing things straight down onto it. And those curves, in a way, are like our shock absorption system. And so if we don't have those kind of curves and healthy ones, then that's when you hear us talking about, we want to regain some curve there and help you with that, because regaining a curve will create less stress on the system for life and really slow down that aging process that doesn't need to happen and doesn't need to occur. They know with lots of different ways in which they study the spine, under pressure, under loads, and with all the imaging we have at this day and age, the technology shows that our spines, well taken care of, should last 100 to 125 years. And so if we see breakdown with them anywhere at a midway point or three-quarter way, like even at a 50-year age point, that's the aging that's been there for a long time that doesn't need to be there and doesn't have to be there. So that's why we're going to go into these movements and motions. So just making sure I stay here on track with the things I want to cover with you. And I brought a couple pictures because I didn't remember to bring all my tools from the house this morning. And some of them I just don't have handy or didn't have handy to bring. But things that sometimes people ask about that I just thought this might be a good one, a workshop to address, because it's things people have at home or ask if they should purchase. Are things like, so this one I forgot to bring mine, so I just printed a picture of it, is something like a Theragun is what sometimes they're called, a massage gun. There's all kinds of names for this tool, but something that's kind of a handheld powered massage tool that has lots of different heads and attachments. So hopefully those at home can kind of get an idea of what I'm got a picture of. I just printed something. It's not the one I own. I don't endorse a company. It's just something that has multiple settings, so multiple speeds. It's nice to have ones now that are wireless, and you don't have to have it plugged in. You charge it like you do your phones, and then you unplug it and you use it. But has multiple different heads, if you will, that attach to it. That therefore you can get more uses out of it. So if someone's asking for something where they can do massage trigger points at home to loosen things up, or someone that's in their, circle that can help them by doing it with them or on them, there's nice different attachments. And I wanted to bring mine so I could show you them, but kind of talking through that round big ball attachment is really good for the paraspinal muscles, things that are big muscles and along the spine, through the back, all those lats, even sometimes the glute muscles, right? It's the big muscle bellies. There's one that's a prong that kind of looks like it's a two-prong attachment. That's really good for, again, going along both sides of the spine and getting those paraspinal muscles between the shoulder blades, places like that. What other one did I think was very, there's one that looks kind of like a Y. So it's got a base and it kind of bridges out like this. And that one can be helpful for like between small muscles. So the best way I could think of that people ask me, well, how do I get to the stuff that's in my arms or in my legs or around my joints? It'd be when you're trying to get through tiny muscles of the forearm. And those of you, if I've ever dug through here and worked on that, you know what I'm talking about. It's not always comfortable, but a tool like that's something you could almost do to yourself. And it has those prongs on it, so you can kind of have a point to get in between these small muscles that there's a few of them that they're just, almost like a gap that you need to get into that's smaller than your fingertip. At least if you have bigger hands like I do, you need kind of a smaller area that you kind of work through between, because there's two bones here, right, of the forearm, just like there's two bones here in the shin. Like here, we just have one big bone, right, in our arm and our thigh. But down in our lower leg and in our forearm, there's two bones side by side. So there's there's muscles there, but there's fascia that's running between those two bones that kind of just help them do their thing and rotate and move. So if you're in there and you're like, oh yeah, I feel these little trigger points, or I feel a little gristly, or I feel little trigger knots, or just feels tender because a lot of us are like this all day, or if you're lifting things for your job or your living, or whether that is boxes of things, whether that is holding a baby, any of those movements where we're bent at the elbow or bent at the wrist, or even if it's doing a lot of this or keying, that we're just always using these muscles. We're always bent at the wrist and the elbow. So those smaller pronged ones are actually really good to get into those kind of very overused areas in our body, which would be like forearms, small areas around the knee. That's probably the two areas I would use the most with that one that's either the Y shape or the tiny little point, kind of a tiny little point shape. Other ones that have multiple prongs, which they all look very different on different equipment. Those are really good for getting across bigger areas. So whether it's kind of your pecs into your delts, into the shoulder, up and across all that overlying stuff here in the upper back, that can be a little hard to do to yourself, but it'd be good for someone else to have, the multi-prong that kind of hits a bunch of those trigger points of muscles. So a lot of people ask me about the attachments. I've never addressed that. So I figured, why not in a workshop like this? So that, if you're getting something, you're looking at how to use it and getting one that has multiple heads. So at least you can use it in multiple ways on your body. Another one that I didn't bring that is very popularly asked about is a Theracane, one that looks like this. So it literally looks kind of like a candy cane, and it's a firm plastic, really, and it has little knobs on it. And what it's meant to do is have areas here or here, really, for and then the middle stick here to hold it, and then you hook the cane around the shoulders, and it's really effective for getting in between the shoulder blades when you have nobody else to get there for you. It's a way you can get it on your own. So I really do recommend those. Those are really nice to get into multiple areas of the back, or hard to reach places on yourself. And the little knobs are just kind of going to work like someone's thumb would in those trigger points. Okay. So that's a great tool for at home to get movement and muscles and loosen things up.
We have a question.
Oh, sure.
We have a question of, are the massage guns safe for pregnancy?
Good question. I would say yes at the lower settings, and we're not doing areas around the pelvis. I would not do anything specifically yourself around the psoas because of just all the ligaments and arterial, like femoral artery stuff here. But I mean, to work on your low back, to work on the glutes, to work on back of legs, to work on the upper back as you get tight from balancing baby weight, and just kind of recentering yourself over a growing belly, then absolutely. I mean, in light settings, I would not do the settings probably above. Most of them go to kind of like a 10 or 15 notch setting, if you will, or intensity. I would just keep it in a lower intensity when you're just doing things on yourself. But I would stay away from major arteries. So you're never doing any of that right here. With a tool like that, you're never doing any of that right through the front of the hip. Now, big muscles like the quads, your IT band, that tendon that I get on with you guys sometimes that can levitate you off the table, right? That's a tendon, not a muscle, but sometimes it has adhesions in it that need tools like that kind of break up those adhesions. The big muscles in your back, your shoulders, and your glutes, absolutely, I would use that to relax things that get tight during pregnancy. And again, I'm saying that all with the caveat that someone doesn't go, okay, I'm going to put it, that more is better. I'm going to put it on setting 15 and I'm just going to hammer on my body for an hour, small doses, start, at a 5, 10, 5, 6, 7 setting and see how your body responds, more is not better with most everything. So with that too, I think it's err on the side of caution and start slow. There's one other tool or piece of, kind of an apparatus that people have asked me a lot about that's a little bit newer, I feel like, and that people are buying online now that you can buy everything online, which there's pros and cons of that, and people using things wrong. I could only find a picture of one of them that I've seen, and I thought this one might be worth showing, which it's used for the psoas. So it's an apparatus that, again, in this picture isn't awesome, but it is a kind of a silicone firmer piece that is flat on the bottom, and it has like a ridge and then an indentation and a ridge. And so it's where you would lay on it there with most of your body weight on your knees and on your forearms. So you're just setting a little bit of your pelvis on and your stomach on those two ridges. And it's getting in on this psoas and this psoas point, like right inside from that part of your front of your hip right here. It's just getting in on those where you feel us sometimes dig in here on the side of your hip and have you do that leg motion, right? It's a way to lay on there with light pressure with your body weight to work on kind of getting in there deeper, because it's hard to do that with your own two hands, right? Everybody's like, oh, I can't ever get in there like you get in there. Well, this would be a tool that you could use. Like, this would not be for a pregnant person. Do not use this tool for in pregnancy. Let a massage therapist or a skilled PT, OT, or doula or work on your or a chiropractor work on your ligaments in your pelvis. But this would be setting gentle pressure this way. And what I like about this one is they're showing multiple ways to use it. So they're showing how to use it for that psoas, your hip flexors. They're showing how you can lay on it for your hips and kind of work through the deep hip muscles. It's showing how to work on it in the low back, so on the left and right side of your spine. And then it's showing how you can actually lay your arm or shoulder on it and get some motion through the trigger points of your shoulder, or even kind of into the trap, or even into some of the tricep stuff back here. That's just hard to reach. So I don't own this one, but I've had a ton of patients in the last 6 months ask me about it. Have you seen that? So it must be they're seeing like Instagram commercials for it or ads for it, or they're seeing it advertised and people are using this to get into spots that they can't get into themselves. So for any kind of tools that you could get, those are ones that I think are helpful, as well as the foam roller, which we're not going into a foam rolling class. We have 5 or 6 of them recorded on our YouTube channel that you can go to and learn every which way to do spinal hygiene for your spine and your muscles. But an at-home tool that's like $25. Do not spend, I mean, you can if you want to, but I would not spend $60, $40 for a foam roller that's it's marked up online because they're painted red and have a Nike swoosh on them or something, for a yoga symbol on them. They're just foam. So I just wouldn't pay that kind of money for foam. But again, people do. If it's what you want because of convenience, great. We have them in the office. You can grab them here too. I would prefer people get a long, skinnier one because you can just do way more on it for your whole body and all the hygiene of the spine and the core, but also the muscles of our extremities, our limbs, right? Our legs, our calves, our arms, shoulders, neck. This is a chirp wheel. That's literally what it's called, a plexus wheel or a chirp. This comes in 4 or so different sizes. This is my favorite size, the medium. I use it along the spine. We demonstrated it in the last workshop for, I think with the foam roller. And it's got this great indentation for the spine, right? The center of your spinous process down the middle, so that there's no pressure right on that like it is here. And then you feel the pressure along the muscles along the side of the spine on both sides. And you just roll up and down from head down to tailbone. And again, we instructed how to use this in the last, one of the last workshops on the foam roller and our tools for low back. So that is another great home tool. Then ones that are also very helpful and cheap would be a tennis ball for trigger points in the shoulders and in sometimes the hips. This is great if you can't handle a lot of pressure, or if this is too much to lay on. Then a lot of times putting this in an area where you can lean against a wall, then you're using a lot less pressure and you're guiding it and just using as much pressure as you want to lean into. So I think I use this one the most for people when sometimes they want to do some trigger points through the glutes, or they want to get trigger points through the shoulder blade area that's just crazy hard to reach. And maybe they don't want to buy a $30–40 Theracane. I mean, a tennis ball is 50 cents. So, and if you have a pet, you've probably got something laying around. Lacrosse ball has a nice cushion too and is nice and soft. That's a great one to use. And this is the firmer ones, and some of them have knobs on it. I didn't think to bring mine. But this is a firm ball for plantar fasciitis, for people rolling the bottom of their feet, the fascia of their feet. And we talked about it a couple workshops ago, and I didn't have it here with me, so I put it in the drawer so you guys could see what they feel like, or even try them out before you go buy one. This was $6 online. I have no idea, this lacrosse ball is sold. I have no idea how much a lacrosse ball is at like a sports store, but keeping those handy at the foot of your bed or side of your bed by your nightstand is great to do when you get out of, before you get out of bed, and when you crawl, before you crawl into bed. So great things for the feet and to roll on, which again, we did in a lot of other workshops, to loosen fascia there. And then with the tennis ball, for me, it's just really putting the arm on the opposite shoulder so that then I'm leaning against the wall through here and just working my way, you know, in whatever position I kind of need to roll to get into the shoulder blade. Then swap sides and put this hand on that shoulder and then place that right around there and lean up against the wall and just go in a motion of whatever feels like it's getting into those spots. This is great for some people into that armpit area that we talk about a lot, all that stuff that helps the whole shoulder girdle motion rotate. So if you're having issues in rotation or clicking or catching, then we need to get into the smaller muscles between the shoulder blade or underneath our shoulder blade and around, or like between our ribs and our shoulder blade. So a lot of times trigger point work like this or that Theracane can help with that. I don't love the tennis ball myself with pressure. I'd rather put pressure. I like the distributing pressure on the foam roller better for my body. But again, whatever works for you and just different in different areas. So those are some really easy at-home spinal hygiene tools you can find. Another one that I have not done before with people, and this is maybe something we do in one of the next workshops on kind of strength and flexibility. I'll make sure I leave one of these here so we can incorporate that. But there's multiple ways to use very simple bands, whether it is doing resisted stretches. So sometimes people will take ones, and some people use towels, but a band is easier. So this is way bigger than I would use, but it's what I had at home. And it's just part of my husband's band system, so use what you got. But some people, it's a doing resistance. Like I'm pulling, as I pull my head back, I'm pulling my hands forward. And it's just doing different resistance motions. And you can do it in multiple different ways. That's sometimes ways that people to work the fascia of the front and the back of the neck and shoulders. A towel or a band is great when you need to stretch. So for hygiene muscles, for ranges of motion, like what we were talking about, if someone is stretching hamstrings, I would rather you're not taking your body and leaning to the floor. That puts a lot of stress on the low back if we have low back issues. And for those of us even that don't, it's just not necessarily the best posture for our low back and our discs. So I always say, bring the legs to you. So whether that is, if you're setting, say this is a curb or a step in your house, or a box on the floor, something that you're just bringing the foot off the floor, soft knee, and leaning in with a flat back. And then I'm getting a really deep stretch at the back of my leg without bending very far at all. So using a towel or a band is a great way to do hygiene flexion resistance motions if, say, you were on the floor. Can I get to the floor, Kayla, and still be seen?
Mm-hmm.
Okay. So for example, if someone has less flexibility, maybe older or injured, then you don't have to do motion standing. It's good to take pressure off the body or off the back. And in stretching the low back or the legs, doing a motion where, if it's hard to bring the leg to you because of flexibility or an injury, then use a strap or a towel and just do this. So we have you do, sorry, I'm on the wrong leg. There we go. Yeah, so when we're doing that piriformis stretch for the back of our hip, if it's hard to reach the leg, then just grab a towel and put it around your leg and pull it towards you, versus feeling like you have to do this type of motion, right? So I don't want you to straighten the neck and using muscles you don't need to for what we're trying to stretch. And then, swap sides. And for some people, it's taking straps or towels around the back of their neck or back of their leg just to do that stretch. Same thing, when someone needs to stretch back here, you don't have to do this and pull the leg to you. A great way to do resistance stretching for hygiene is put, this around the foot, and then just whatever resistance you want to bring, you bring. Point and flex the toe, and you're just going to get a whole different level of stretching by just adding some resistance in a band. If you don't have bands, use a big towel and just use your, some resistance by pulling with the towel to just resist, and you'll just get such a deeper stretch there than just doing this. And it's, again, getting movement in a sense almost through the stretch. Last one while I'm on the floor that I'll show you is just doing some spinal twisting is really great in that lower back when you don't have your body weight on you. So when you're, laying down versus standing up and twisting. So we'll teach spinal twist like this, guiding it with the hand if that feels better, or just bending both knees and letting them fall to the floor where they feel comfortable. So where you feel like this might feel like you have a little more control. So just different motions that allow the low back to move that don't require a bunch of other movement or stress or strain upon the joints, okay? Some of the last few I'll show you as we wrap up. It is always nice to do wobbles, and wobbles from how we do them on the wobble cushion. And those are really inexpensive to buy. I think they're about 20, 25 bucks at the most, to get somewhere in there. And a lot of people have these spitballs still laying around. So I brought mine because we use it in our basement still, and sometimes do some work on them. And this needs more air in it for how tall I am. So I should be more air in it, so I'm at like 90 degrees when I sit on it. But just showing that you can use something like this to wobble as well. So getting motion in the low back and spine and being able to pivot left and right. And again, I didn't put more air in this like I should have. And being able to rock forward and back. It's definitely not the same as having a cushion that pivots you more succinctly, but you can use it that way. And again, if it had more air in it, I wouldn't be practically sitting on the ground right now. But that pelvis motion of just loosening up the low back, that hydrates our discs, that keeps them mobile, that keeps that fluid moving around in the joint that gets really achy and stiff after sitting still for too long or standing too long. So left and right. And you can add arm movements like we do in the office. As you get better at this, it just opens it up more, involves more movement in the body, and then left and right. So tucking the belly button in, and then almost arching and sticking the belly out or butt out, right? So these are some good motions that you can maybe use if you have one of these at home that mimic similar to what we do when we use the wobble cushions, or what we call like a Dynadisc, right? A vestibular disc. So that's a tool that many people may have. And one of the last ones I would show you is just a broom. I think most people still own one of these, unless you've, donated them and have just like the Roombas or whatever that goes around and picks up things for you. But just taking a broomstick and letting it rest, and just as long as, that motion there doesn't bother your shoulders to bring them at least this far, and just really in a plane of, again, rotation, just allows you to open up the mid back and the low back in very different ways. And it helps us keep our head and shoulders back while doing it. So that's just a good posture that opens up our chest after doing all of the forward posture of our day, whether it's over a kiddo, whether it's over equipment, whether it's over a keyboard, right? Or kids, students over books and laptops and all that stuff. So just a way to get some really good motion through the spine and stay in a really nice neutral posture doing it. I think that was the most I wanted to show you. There were some really good exercises brought up in hygiene that I believe we covered when we did the workshop Strong Back at the beginning of the year. But it was things in related to the 4 motions we did, like a cat cow, right? So on all fours, dropping the belly in, rounding the low back like a cat does, and just opening up the hygiene for the low back. You're on all fours, hands and knees. We covered that a few workshops ago when we were doing one of the spinal hygiene ones. Being able to do kind of the bird dog, right? Where you're on all fours and you're lifting one arm up and then just the other arm, and then you're getting to where you're doing opposite arm and opposite hand off the floor, all while engaging your core and keeping a very flat, neutral back. Great spinal hygiene when you don't need weights, don't need equipment, just need, carpet or a nice mat that you can be on to do on your hands and knees at home. One that I don't know that I've shown in the workshop that I'll end with is when we give an exercise called, for the low back and spinal hygiene, called the McKenzie, or sometimes you'll hear me call it like a cobra exercise. That is a great hygiene movement for the low back and the discs. And so I don't think I've demonstrated it before, and I don't know that Doc has either when she did her last hygiene workshop. So just to show it, because we get asked it a lot, it would be coming down, and I'll show multiple ways. It'd be coming down on the stomach, hands just relaxed here at your shoulders, and spine pretty neutral. The motion is just here. And it's for the low back. And so if this is like, if bending forward hurts your low back or is stressful, but arching it feels good, do this. And I would just say, go where it's comfortable. There is no right, there is a wrong, there's really no right. You're not after a certain angle. If this feels as good as far as you can go, then great, start there. If you can be here, fine. I don't need to be here. It's just about pumping that motion of the joints in the back of the vertebra and the disc, and so the cushion between the vertebra. And it's just doing this motion about 15-20 times. And then that would be like a set. And then I may have you do a second set. That is an exercise we give many people when they have sciatic. So radiating pain, sharp pain down the buttock or into the leg. That's a great motion to try. And I would say you're doing it. The last thing to cover, which with all these things is really frequency, right? Time, frequency, intensity, is that many of these stretches should be being done multiple times a week. Some of them, the postural ones, a couple times a day. We all sit or stand or hover over things way too much. We're way too sedentary. So we've got to get the right movement in our spine. Even if we're busy throughout the day, like even adjusting all day. I'm never sitting, but I'm doing a lot of repetitive motion, hovering over patients. So I do a ton of these things in my daily and weekly routine all the time. So, and throughout the week, always. So you'll find what your body needs in the moment and gravitates towards. But some of the motions, if you're getting sharp shooting with that McKenzie exercise, is that, or any signal down the leg, is trying that to see if it relieves it. And then you continue doing it so that it will stay gone. And so that motion of the joint has to happen frequent. So I always tell people, you do it flipped over onto your bed before you even get out of bed. And you do 10 or 15 of them. Then you're gonna get up, or after you get out of the shower and get moving and warm up the muscles, you'll do a set then, if nothing else, in the morning. Then it's, you know, maybe 9, 10 o'clock, you're doing a set. And then lunchtime. And then, you know, maybe 3, 4 o'clock, or right after dinner. And then again, at least right before bed, or as you're crawling into bed. So minimum 5 times a day. And then that's just consistent to do a set every couple hours to keep that low back moving and keep things where they're supposed to be. And if that minimizes that shooting down the leg, or brings it from down the leg to just up to the butt, or into somewhere higher up and localize more at the low back, then great. We kind of know what we're doing or how it's taking pressure off, and giving us idea of where there's pressure on things and what relieves it. So that happens a lot of time in pregnancy, when the baby weight starts pulling our pelvis forward and we start kind of coming into this overarched posture. And then there's just more activity of muscles back here. So sciatic can be common for pregnancy for some people at different points of the pregnancy. We see much less of that when patients are getting adjusted during their pregnancy, because we're watching that a lot closer and the pelvis is staying a lot more neutral. And if you're pregnant, the way you do that is you're not going to get on your belly and do that on the floor. You are going to, 1 second, I'll come back to you. Have to bring these over. You could use a ball like that, but I would just take, you could, if you're comfortable on your knees, and put a pillow or a cushion underneath you. Don't get on a hard floor like this with your knees. But you can just lean over a chair, or lean onto your couch, or over an ottoman, something that's this kind of height. And what you would do, and again, I wouldn't normally tell you do it on something with wheels, because I don't want this moving out from underneath you. So I just like the height of this with where I'm sitting here in the office. But you can do that same motion where you're just dropping the hips forward. So pretend I'm not on something that moves, and I've got a stationary chair or ottoman or couch or something there. And you're just doing this motion. So, and that feels very good most of the time. And the last one I'll show you is that same motion if you're somewhere where you can't get on the floor. I mean, you're at work, or you're out and about, or you're out on a hike, and all of a sudden your back starts doing some of that spasming and is tight. You can do it up against a wall. So, Kayla, you can turn me to maybe even just right here. That motion can just be this, right here. So you just drop forward. My hands are doing nothing. I'm just dropping my pelvis forward as if I was on the floor, but and arching up, right? And it's just that gentle motion there. And it feels very good to get movement where it's needed in the low back with nothing but your body weight, no extra stress. So those are 3 different ways you could do that same motion as I did on my stomach on the floor. So I hopefully that gives you some additional tools or ideas of how to use some things you already have, and maybe some different ways in which to do them, or a different motion that you haven't done before or incorporated in. Even if it's something as simple as opening up the chest and mid-back and doing rotational stretches with a broom, movements with a broom, or some spinal twists with the low back, beyond just tools like rolling and things we talk about all the time. So let us know what your takeaway was. Let us know if there's something that you haven't tried that you know you have at home that you're going to give a go at, and let us know how that is for you and how we can best support you in your spinal hygiene movements. Thanks for joining us. Thanks for giving me a few extra minutes there to cover some things that I think we haven't got a chance to talk about in our last several workshops of hygiene, and looking forward to hearing what you're going to add in to some of your routines. Have a great night. We will see you next Tuesday. Same time, same place. Thanks. Absolutely. Thanks for joining us, everybody.